basically there are loosely 4 different drug groups, okay, that exert their effects on the autonomic nervous system, okay? And both the PANS and the SANS can be affected. And the actions of the drugs, okay, either increase what our body would do by stimulating them, right? Do the same thing as our body, or block them, right? They don't exert drugs don't exert new functions to the body. They either do more of the same, or they block them from doing what the body would normally do. Okay, so of the 4 groups, there are 2 in the PANS and 2 in the SANS, okay? So we talk about the PANS being cholinergic primarily, right, because of the acetylcholine. And a drug that stimulates the PANS is going to be called parasympathomimetic. Okay, another long word there. We already know parasympathetic, right? Parasympathomimetic. What does a mime do?
Mimic.
It mimics, okay? Got our mime there. I didn't know this thing worked. This is one of these other ones there, okay? So we got the mime. My husband hates mimes. I don't know why, but he just thinks he doesn't get the point. All right. All right. I don't know why. Just like he goes crazy when he sees a mime. He just doesn't understand. Okay. So a drug that stimulates the parasympathetic is parasympathomimetic. Okay. Or the other thing that they call it is a cholinergic agonist. Does an agonist do the same thing as the body, or does it block it? Same. It's your buddy. It's agonizing with you. Okay? You see why I do these stupid things so you guys will remember? I'm doing the same thing as you because you're my buddy. Okay? A drug that blocks this system is called either anticholinergic, okay, against the cholinergic response, okay, or a cholinergic blocker, okay, or antagonist, remember that? Okay. Or it's called parasympatholytic, okay? When something is lysed, like if they talk about a cell body being lysed, it's destroyed, okay? Killing germs with Lysol. Do you think maybe that's why they call that? I think that's probably what, Lysol, I love it. Okay, we got Lysol now. I gotta put a Lysol can on there, okay? Parasympatholytic, it lyses it, okay? Or a cholinergic blocker, or a cholinergic antagonist. Back to the SANS now. A drug that stimulates the sympathetic autonomic nervous system is called a sympathomimetic. Mime, it does the same thing, or an adrenergic agonist, okay? It's the adrenaline's buddy, it's the epinephrine's buddy, all right? And so that's gonna be there's our guy, okay? This has been the football game last night, all right? I stopped watching at Lady Gaga. So, and then I went downstairs and my husband's like, you are not gonna believe what just happened. Okay, so wild stuff, okay? So there's our guy, and I kind of like it because the PANS guy. Okay, and then we've got the sympathomimetic, right? This is the guy with all the adrenaline going, right? Okay, so that's our adrenergic agonist, our buddy, okay? And then, so they're football buddies, I guess. And a drug that blocks it is going to be our adrenergic blocker, or our sympatholytic, okay? We spray a lot of Lysol on that guy, okay? Or sympathetic blocker, or sympathetic antagonist. Do you see all these words? All meaning the same thing, okay? Hopefully that helps you remember, okay? So, cholinergic, parasympathomimetic agents, anticholinergic, or parasympatholytic agents, okay? So we're going to talk about those, the parasympathetic autonomic nervous system drugs. We're also going to talk about double negatives, cholinesterase inhibitors, and then nicotinic agonists and antagonists, okay? I'm not explaining these now, we're just telling you what we're talking about. Okay, so we know with the PANS, the parasympathetic autonomic nervous system, okay, that acetylcholine is the principal mediator, okay, we've all had that driven home. The action potential causes that release of acetylcholine, and in the postsynaptic, okay, the tissue is the effector organ, and we know that acetylcholine is released there. But if we keep having the effect on the effector tissue and it doesn't stop, we're going to get an excess of effects, right? So our body has to do something to stop it, okay? So it has a chemical, okay, called acetylcholinesterase to metabolize it, and it makes an inactive metabolite out of it. Remember that we talked about with drugs? The metabolite is what our body does to things to inactivate them and get rid of them. Well, our body does that to our own chemicals too. Because if it tells you if it releases the acetylcholine and makes you cry, at some point you got to stop crying, right? Okay, at some point. So it's going to say, okay, stop now, all right? And it releases the acetylcholinesterase, okay, to inactivate it, to make a metabolite, and to stop the action, okay? The body metabolizes its own chemicals, as it will do the same to drugs, okay? It's an amazing thing. So acetylcholine is then terminated by our body by acetylcholinesterase. ACH, acetylcholine is ACH, right? ACHE, an enzyme to break it down, okay? It actually stands for esterase, but you can think of it as the enzyme that breaks it down, acetylcholinesterase. And then drugs are we're gonna use this to make our drugs work or not work, okay? Okay. The PANS drugs, as I said, different drugs act on different receptors. There's not one kind of receptor. There's a bunch of different kinds, okay? So they are selective to certain receptors, okay? For instance, and this is why I told you it makes a difference before when we learned about voluntary muscle. Atropine is used to dilate your pupils, okay? So if you've had eye surgery or an eye exam, they will use something like either atropine or something like it, okay, to dilate pupils. It blocks acetylcholine, okay, at the PANS, okay, which usually constricts it, right? What does acetylcholine have? What happens to Pansy when she's sitting in bed? Meiosis, right? Her pupils get small. So if something blocks the acetylcholine, it's going to allow them to enlarge, okay? But it doesn't block acetylcholine at the neuromuscular junction. So it's making our pupils big, but it's not preventing us from moving if we want to. Okay? Some drugs actually do both. All right? So that's good. So we get our eyes dilated, but then we can walk out of the doctor's office with those really groovy glasses, right? Anybody ever have their eyes dilated? Yeah. All right? Now there's another drug called curare. Okay? Curare is something that can be extracted from plants and has been used in poison darts. You see like pictures of, you see old movies of like natives in the jungle like shooting poison darts at people. And then when people get shot with the dart, the chemical that's in there causes them to completely spaz out, right? And not be able to move. Because it blocks acetylcholine at the nicotinic receptors at the skeletal muscle. Not good, okay, if you're trying to run away from your enemy or whatever, okay? But it doesn't block it at the salivary glands. Who cares? They're in your head, all right? So what the thing to remember there, the drug action, okay, will be specific to either the muscarinic or the nicotinic, or sometimes even both, okay? But these are specific, one's to the nicotinic and the other one is to the muscarinic. Do you see why it makes a difference now? So when I say to you that it blocks the muscarinic and not the nicotinic, you can picture that your eyes the pupils are dilated, but you're not, you're not paralyzed. Okay. So cholinergic, parasympathomimetic agents, okay, or drugs, can also have two classifications. They can directly act on the tissue. Yeah, go ahead, Carissa.
So the atropine or atropine?
Atropine, yeah.
Blocks the muscarinic?
It does.
No.
Correct. Yep. The other one is the nicotinic. But we probably don't have to worry about the curare, but we do have to worry about the atropine. That's a common drug. Okay. So direct acting actually acts directly on the receptor. So if you look here, here's the acetylcholine coming out, okay? And the cholinergic drug, that's the C, is the cholinergic drug, binds directly to the receptors on the postsynaptic cleft. Right? See it? Okay. Indirect acting, okay, causes the release of an enzyme, okay, right there, causes the release of an enzyme, and then the receptor will bind to the enzyme instead. Or you can have the cholinesterase inhibitor. Remember we talked about the one stopping the action? So the chemical may get released, but the inhibitor causes it not to have an effect. All right, very general. So either acts directly, or it allows the binding of the neurotransmitter to have an effect, or it can inhibit the breakdown. So there we are there. Right. So there's the direct acting cholinergic drug binding right to the receptors. Indirect acting, we have the cholinesterase inhibitor inhibiting the acetylcholine from binding to there. Okay. And the acetylcholinesterase stops the effect. So what about some drugs, okay? It'll make this make sense as to why we're using it, okay? Direct acting agents, okay, include pilocarpine or Saligen, which is prescribed for people with very, very dry mouth. I don't think your book mentions civameline, okay, it's a newer one, Evoxact, okay? That is also used. These can be used for people with very dry mouth from a variety of different things, including something like Sjogren's syndrome that we talked about, all right? And the civameline is the newer of the two. But these are drugs, these are cholinergic agonists. So when you go to look up drug information and it tells you that's a cholinergic agonist, you're gonna be like, I know why that works in increasing saliva, okay? I actually know why that works. And you're gonna have patients that are on these medications because they have very, very dry mouth, and we know what that can cause, okay? There are indirect acting parasympathomimetic agents, or those cholinesterase inhibitors that inhibit the acetylcholine from being broken down, okay? One of them is called physostigmine, okay? And this is actually used to treat drug toxicity, okay? So if somebody's having a toxic reaction to a drug, like an antidepressant, okay? Or if they take too much of it, they're trying to get rid of the effects, okay? Physostigmine can be used. So again, a very important action of drugs by knowing how drugs work in the body. So we're not going to get somebody going toxic on us with an antidepressant. Okay. What about some of the pharmacologic effects of the cholinergic drugs? What about on our very important cardiovascular system? Okay. Usually the effect that the parasympathomimetic agents or the cholinergic agonists have on the heart is to produce what's called a negative chronotropic. Does anybody remember chronos? Chrono means what? Chronological has to do with what? Time. Okay? So the heart rate, negative chronotropic would mean that it would speed the heart up or slow it down? Slow it down, okay? So the cholinergic drugs, cholinergic agonists, have a tendency on the cardiovascular system to slow things down. Remember Pansy sitting in bed, right? Just sitting there, resting and digesting with a low heart rate, okay? And an inotropic action, so how much blood gets pumped out, okay, is also affected. So it reduces the force of contraction, right? If you take a water balloon and you just squeeze it, make a little hole and you squeeze it slowly, right? The water comes out, you know, with not a lot of force, okay? You pop the darn thing and you got a lot of force of action. It comes out very quickly. So we talk about decreased cardiac output. It doesn't put out as much because it's not being squeezed as hard and a slower rate. And smooth muscle relaxation and vasodilation, okay? The blood vessels are dilated. Okay. Indirect effect is that there's an increase in heart rate and cardiac output. Opposite effects. Well, our bodies are very protective of themselves, and if we find that our heart rate and cardiac output goes down too much, we jump back in to get it started back up again, okay? Have you ever heard of the term reflex tachycardia. Bradycardia is what? Slowing things down. Tachycardia is speeding things up. So if our body finds it's down too low and it's afraid we're just gonna like expire, okay, we get something called reflex tachycardia. So in the future, we're gonna talk about reflex tachycardia happening if things get slowed down too much, okay? But generally speaking, when we ask you what the cholinergic effect with the parasympathomimetic drugs have on the heart, it's gonna be to slow them down and decrease the force of contraction, okay? Negative chronotropic and a negative inotropic effect. Yes, Leila?
The book says about positive too, right?
What do you mean about positive?
Chronotropic and positive inotropic. And when it goes the other way, one of them, that the positive one that speaks up, it affects the force of contraction. But the other one specified that does not mess with the force of contraction.
Certain drugs, that's true.
What is, yeah.
That's true.
So I'm getting confused. Is that the
Yep.
same or is it?
In general, the direct effect is negative chronotropic and negative inotropic. When we talk about the indirect effect, okay, we can get an increased heart rate. What happens more often is an increased heart rate, but not increased force of contraction.